Hey everybody, you all know I like to dress up as different specialties in medicine, but I am actually a board certified ophthalmologist, and I want to talk about something very important for a few minutes: blindness. If you ask 10 people to give the definition for blindness, you're going to get 10 different answers. And I would guess a lot of people think that being blind means you just don't see anything, just black. And that is rarely the case. Blindness is a spectrum, and I want to explain what we mean when we say that. There are two main parameters we use to assess visual function. There's your visual acuity, that's your ability to look across a room and read the letters on the chart. Then there's also your visual field, which is your peripheral vision all around you. Let's start with visual acuity. In the US, we consider perfect vision to be 20/20. If you have 20/40 vision, that means that what you can see at 20 feet, someone with perfect vision can see at 40 feet. So they can move back 20 feet and still see the same thing you're seeing. If you have 2200 vision, that means that what you can see at 20 feet, someone with perfect vision can see at 200 feet. They can go way back and still see it. Now, the largest letter on the chart, that's usually about 2200. But some people don't even have that level of vision. They can only see finger counting or hand motion, or some people have what we call light perception vision, where all they can see is light coming from different directions. All of that is still useful vision. Even if you can only see a hand moving in front of your face, you can still see that somebody is standing in front of you, or an object is off to the side. You may not be able to tell what that object is, but you know something's there, or you can tell where light is coming from, and that can help you navigate the world. So clearly there's a range of visual acuity. So what's the definition of blindness? Well, it depends on who you ask and what kind of activities you're doing. Let's take driving, for example. Most states require you to have at least one eye that sees 20/40 vision in order to qualify for an unrestricted driver's license. So if you have 20/80 vision in both eyes, are you considered blind? Well, according to the Department of Transportation, yeah, I guess so. But people with 20/80 vision often can navigate the world just fine. They can perform their normal daily activities and take care of themselves and do things they like to do without much difficulty. People with hand motion vision, well, they have a different definition of blindness because they certainly need help crossing a busy road, whether it's a guide dog or a white cane or someone helping them. But they can have conversations with people. They can know you're sitting in front of them. They can look you right in the eye and talk to you. And that's a level of function that's slightly different, but maybe they're considered blind as well. Then there's peripheral vision. So we have a way of measuring this in the eye clinic. We put your head in like this bowl thing, and you hit a button when you see a light, and it maps out your visual field. So this is an example of the readout we get. Don't worry about all the numbers and stuff. Basically, white space means you saw the thing. So that big black spot right there, that's your physiologic blind spot. We all have that. We don't see it, though. Our brain just filters that out. This is the peripheral vision of someone with glaucoma. So you see all that black space. So this is the person's left eye. And basically what that shows is they cannot see from like midline up. They don't have any superior vision out of that left eye due to a disease called glaucoma. And this is the peripheral vision of someone who's had a stroke. So this is both eyes, left and right. And this person has lost all their vision on the left side. They don't have any vision to the left. This is someone who does not qualify for a driver's license because almost all states require you to have a certain amount of degrees of visual field. But this person can't see anything to the left. They might actually have 20/20 perfect vision straight ahead, but they have no vision to the left. You can imagine how dangerous that would be, not being able to see anything coming off to that side. So these are often very difficult conversations we have with people. Would this person be considered blind? Well, they are severely limited. This is a major change to their lifestyle, sometimes for their ability to function, especially if they live alone. So this can turn someone's world upside down. Then there's a person like this who only has a very central small island of vision left. They have some disease, there's several diseases that do this, that can just take out all of your peripheral vision. This patient has no peripheral vision, just all they see is a really small island right in the center. So they might read 20/20 on the chart, 20/15 on the chart, but their function is severely limited by their lack of peripheral vision. Is this person blind? Does this person consider themselves blind? The point is, vision is complex, it is incredibly important to everything we do, and there's no one definition of blindness. It affects different people in wildly different ways. Blindness is a spectrum.